My name is Megan Vickers. I'm a physiotherapist and Pilates instructor, and this is my Pilates for Pregnancy program. Welcome to month six of my program. In this month, as our baby bump is growing, we're going to be working on our posture, our mobility through our spine, and getting some strength around our pelvis and pelvic girdle to prevent against pelvic girdle and low back pain. So we've got a long sequence in standing to work on our inner thigh, our bottoms, all the muscles which connect and bring our pelvis together in forced closure, as well as a lot of postural opening and deep core muscle work. You'll need a band, so an exercise band or some small hand weights, and a soft Pilates ball or cushion. Okay, so we're going to start in standing with mobility. So standing on your mat, we're going to open up our toes and we're going to line our heels up with our toes. We're going to do some big shoulder shrugs to get some movement in that upper body. First, let your head float off your shoulders, so you're stretching out your spine. And then bring one shoulder forwards, up towards your ear, down to the side, into the middle, and all the way up. Shoulder roll behind you. One of my favourite exercises, to just open up your chest, mobilise that upper back, and stop that rounded posture that we all have a tendency to go to, particularly as the weight of our baby grows. One more time. Now we're going to work on rotation. So we're going to bring our hands in front of us for spine twist. Breathe in, grow tall through the top of your head. Breathe out and rotate all the way round to one side, keeping your pelvis pointing dead ahead, so the movement comes from your breastplate. Nose stays in line with your fingers. Breathe in, breathe out to the centre. Grow tall again, lengthen, and rotate the opposite way. Really work on the pelvis pointing forwards. Feel how tight you're getting and really come to the end of your range. Lengthen, rotate, and again grow tall, open, lengthen, rotate. One last time. Grow tall, rotate, lengthen again, and to the centre. Now we're going to try an exercise called bow and arrows. So you can have your arms in front of you and imagine pulling the string on a bow as you bend one elbow and you look out over that shoulder. Then lengthen through the arm and circle the arm all the way around you. Again, you're trying to keep your hips pointing dead ahead. So the elbow bends, reach that arm back behind you and circle it around. And that reach and twist with the elbow, almost press your shoulder back, get that chest open, the upper back mobile. We're going to be having a lot of forward posture activities to come in the next few months. All that carrying, feeding and lifting that we do as mums leads us into this rounded shoulder posture. And this is a great exercise to keep that chest open and your posture tall. Okay, brilliant. We're going to come against the wall. I'm going to get you to start with your cushion straight away. So ball or cushion between your knees. And you want your feet maybe a foot and a half away from the wall, just so when you start here, you are leaning into the wall and you can pop a little bend in your knees without your knees coming forwards of your toes. So the first thing we're going to do is a shoulder bridge against the wall. A squeeze of the cushion is just going to help with this forced closure across the front of our pelvis, across your pubic bone here. So first thing what you do is think about your pelvic floor. Think about closing your pelvic floor at the back passage, vaginal canal, urethra. Now add in that ball squeeze, so everything through the middle of your body is closing. Hold that, press your hands into the wall, tuck under your tailbone, so your back presses into the wall, and peel your back up off the wall, one vertebra at a time, getting some space in each and every vertebra, and then come down. As your back comes down, you're gradually releasing your pelvic floor, you're releasing the squeeze on the ball, you fully relax. So again, tailbone, closing that back passage, vaginal canal, urethra, ball squeeze, I'm tucked right under, my back starts to lift off. And now release down, one vertebra at a time. Pelvic floor is relaxed. 3 more. Breathe out to initiate that pelvic floor close all the way through to the pubic bone. Ball squeeze, peel, tuck, Top baby moves in towards your spine and your back lifts up off of the wall and then come back down. And as a ponytail here is not ideal. Just get your head as far back as you want to. Release that pelvic floor. Now engage again. Back of your pelvic floor, middle of your pelvic floor, front of pelvic floor, ball squeeze. Lifting. Feel that baby move up and back in towards your spine. Get that space through your back, maybe palms front to exaggerate that chest stretch. And then come all the way back down. Last one. Close and lift. Starting through the back, moving to the front now. The whole front of our body is strong. As we come up and we come back down. And release. Okay, now find your pelvis neutral. So you've just got that mobility through your back. You've woken up all of those muscles up through your tummy and your spine. Do a few pelvic tilts until you can bring your pelvis into a neutral position. Your back should be close to touching the wall. You're not all the way back and pressing into the wall, but your back is pretty much flat against that wall. We're just going to do some little mermaids here. So keep your back pressed against the wall. Slide down to one side and reach the other arm all the way up and over your head. Create some length through your waist, keeping that back against the wall, and then come in. Throughout this series of exercise, imagine giving your baby a hug. Wrap your muscles around baby. Feel baby move up and in. This is your deep muscle system, your transverse abdominis, which acts like a corset. And we want to keep those postural muscles strong in all positions, not just in neutral, but as we move our spine as well. Last side bend with that muscle active. And then back in. Now we're going to hold it here. We're going to ball squeeze. We're going to lift halfway through our pelvic floor this time and add in that baby hug. First thing I want you to do here is squeeze your ball and lift your heels up off the ground and then come back down. Heel squeeze, heel lift as you squeeze that ball. Breathe out, breathe in. Squeeze the ball. Keep your baby hug on, pelvic floor lifted just maybe halfway, not your maximum contraction. And what you're doing here is you're strengthening into this neutral posture. So you're shortening your tummy muscles just enough to create strength, to keep strength in those muscles as your baby grows. But you're also just getting that work up through your legs into your pelvis, giving us that forced closure. Bottom is active, thighs are active. Okay, now we're going to bring in that upper body. Out breath, ball squeeze, heel lift, arm float. Breathe in, release. Breathe out, come up. The wall's a really useful tool as our babies grow, because our posture changes so much, but little by little, we often don't notice those changes. So the wall's a really good guide of how far we're going into an anterior tilt to a rounded posture and helps us to correct all of those changes. Now as those arms come up, make sure the ribs stay down, the back stays against the wall. Three more together. 2. Hold it halfway with the arms. So your arms are up in front of you, your ball is squeezed, your heels are lifted. I want you to lift your heels a little bit more as the right arm comes up. Back halfway with the heels. Lift a little bit more and halfway. Lift a little bit more. Keep that ball squeezed. You're getting that forced closure through your urethra, through your pelvic floor, through your pubic bone at the front. Those tummy muscles are coming together. We've got some good core strength active here. Keeping that neutral spine. Give me 7, 6, 5, 4, 3, 2, 1. And relax that down. Use your hands to push back up away from the wall. Ball is going to stay between the knees for the progression of those exercises. Picking up your exercise band. So think about how your body felt when it was against the wall and how we get into that neutral spine. How as we just gently tuck under our tailbone, it's like giving our baby a hug. A hug which lifts our baby up and in towards the spine. Grow really, really tall through the top of your head and open through your collarbones. And you're going to start with the band across your hands with your elbows in at your waist. Now you can do this just as easily with 2 small hand weights or 2 small bottles of water, works perfectly fine. Keep your shoulders down, baby hug. Breathe out, ball squeeze, and then palms open to the side. Breathe in, release that ball squeeze. Breathe out, squeeze the ball, palms open, breathe in, release. Breathe out, open, breathe in, release. Got those deep tummy muscles lifting up and in, wrapping around, baby. The pelvic floor is gently lifted, and every time we add in that squeeze of our legs together, getting that inner thigh working. Out breath, in breath into your rib cage. Out breath, in breath. Out breath, in breath. Two. Hold the next one for me here. As you reach your arms out, I want you to come up onto your toes. The palms stay out to the side. You pull on the band, rise up onto your tiptoes and come down. If you can, keep that ball squeezed the whole time. We try not to lift with our shoulders, but our shoulders stay down. Our chest stays open. That baby hug is strong. All this arm work is great to raise your heart rate. So good to practice raising our heart rate, getting out of breath. It's good for our bodies, but it's also good preparation for our babies too. Think about a deeper baby hug. Each time you rise up, you need even more stability because you're balancing here. Keep that ball squeeze if you can. 4, 3, 2, 1. And release. The band now comes into your hands, and your hands are going to be up in front of you. The action here is on your out breath, you bend your elbows and you squeeze those shoulder blades down your back, and then you release them up towards the sky. So this time what we're going to do is we're just going to push our bottoms back, keep our pelvis in neutral. The ball is still squeezed, just a little bend in your hips. So as we pull down, the hips come through, the baby lifts up and in, and then release that tailbone back behind you. Getting some movement through your pelvis, some movement through your hips and legs, some stretch and release through your pelvic floor, some strengthening through your pelvic floor as you lift. Arms shoot up, sit back, squeeze, close, lift, and stretch. Pull on the band, squeeze the ball, lift the pelvic floor, and release, sit back. Come up. So we keep this baby hug, this gentle pelvic floor lift, but as we increase that effort on the way up into standing, we increase that pelvic floor contraction just a little bit more. So we're holding maybe 30-50%, and then we're coming up 70, 80, maybe 100. Release halfway. Takes a lot of practice, so see how you go. Try and get just a sensation of movement through your pelvic floor. And up and a release. 6 to go. Keep those ribs flush with your tummy. That pelvis moving out, tucking under and in. Out, tucking under and in. 3 to go. And last one. And release down. I'm going to release the ball just for this last exercise. Hands are going to come up in front of us. The pelvis is going to stay level with your baby hug. Now as I pull open on my right arm, I'm going to raise up onto the toes of my left and then return in. Breathe out and change sides. So the arms are working out. It's raising our heart rate in this warm-up. Really working our postural strength. Those leg raises are also challenging our pelvic stability. Not only that, as we move into the end of our second trimester, start of our third trimester, It's important that we don't exercise our upper body without involving our lower body. Standing still can reduce blood flow to the uterus, so we want to keep those legs moving. Good, keep that baby hug lifted. 8 to go. No catwalk hips. If I trace a line from one pelvis bone to the other, there's no wiggle at those hips. That line is perfectly straight. 4, 3, 2, 1. And relax down. Really big shoulder shrug. Release those arms. Okay, so we're going to move now onto all fours. Hands and knees is a brilliant position for us in second and third trimester because it's such a stable place for the shoulders and the hips. Really builds strength up around those areas. So at the top of your mat, start with a roll down. Chin comes to your chest, shoulders come forwards. Low back stay still for as long as possible. When we feel that end of our range in our upper back, then you start to curl through your low back and then fold at your hips. Chin's pressed into your chest, chin to your breastbone, compressing the front of your throat so your neck gets a good stretch. Check in with your blood pressure, take your time, and then bend your knees. Okay, single leg work. Now, if you have any signs of pelvic girdle pain, you might just want to reduce this range a little bit, or wrap a band around your legs to give you even more forced closure. If we're showing signs of pelvic girdle pain, then the best treatment is to strengthen around there. Okay, so hands are underneath your shoulders, your chest is lifted, and you look straight down. Relax your body to begin with. Then as you think about your pelvic floor, close and lift through tailbone, vaginal canal, urethra. Relax that down. You should feel baby just move up and in. As you close through your pelvic floor, you get that co-contraction through your deep tummy and that release as you let go of your pelvic floor. Now, if that doesn't go strong enough into your tummy, then what we might need to do is imagine that baby hug again. Imagine lifting baby gently in towards our spine. We're just going to keep that little baby hug on the whole way through this exercise. Now the ball is behind my left knee to get my hamstrings, back of my thigh really working. Okay, chest is lifted, baby hug is on. The first thing I'm going to do is just lift that leg up off the floor. It just comes a small movement. The pivoting movements from the hip. I'm looking down my body that my right thigh is vertical. Don't let your hips go out to the right. Keep your right thigh vertical. Chest is lifted. See how much you can move, how much range you have available here. Baby hug on. Trying to keep your spine as still as possible. 3, 2, 1. I'm going to hold it up and I'm going to squeeze the ball. I'm going to try and maintain that pelvic floor baby hug lift. Not release it between every leg release. Just keep it on as I squeeze that ball. You see my leg's not as high as it can go because then I might start to dip my back. I'm just taking it up to where I can feel the back of my leg work, where it's challenging my body, but I can maintain my spine in a neutral position. Give me another 10, 9, 8, 7, 6, 5, 4, 3, 2, hold it still. Imagine I've got hold of your foot and allow your knee to come out to the side. Again, just check in for any pelvic girdle pain. If that adds any pain and pressure through the pubic bone at the front, stay with those straight leg lifts or pulses. Lift through baby, keeping that spine in neutral. Climb into that leg. Starting to feel the opposite bottom working now too, hopefully. 4, 3, 2, 1, and come down. That little ball stays behind the knee. Last exercise, opposite arm and leg lift. So you're really increasing that tension down through the front of your body. So as you're stretching away, all those muscles pull taut, and then come back in. Leg never touching the floor, hand not touching the floor. Stabilising arm, working really, really hard. See that balance challenge here now. As baby grows, 5 to go. Baby hug. Last one. And release. Little changeover for me. I want you to take the ball between your heels and your knees open. Now if you want to give your wrists a rest, then you can just come down here onto your elbows or forearms, or you can come up onto your fists, whatever's most comfortable for you. All we're going to do here is some co-contraction, pelvic floor, deep tummy muscle with a ball squeeze. These squeezes are such a good exercise. It's what we call an isometric exercise, a static exercise. Just brings strength through all those muscles without too much stability, too much dynamic movement. So what we're going to do is lift our chest, tuck our chin, and on your out breath, start through the pelvic floor, close and lift, tailbone to pubic bone. Hug your baby in towards your spine. Now squeeze the ball, and I want you to hold for 10. Breathe into your ribs. 3, 2, 1, and release. And again, lift your chest, lift your ribs, find your neutral position. Now, tailbone, vaginal canal, urethra, baby hug, ball squeeze, hold, 10. 3, 2, 1, relax. One more time. These are brilliant postnatal exercises because your body needs time to repair, and that means keeping things still for a while and just creating stability through there first before dynamic movement. So it's good to get these well rehearsed now before baby comes. Chest lift, look straight down, ribs lift, pelvic floor, tailbone through the pubic bone, baby hug, ball squeeze, 10. 2, 1, release. Okay, second side. So we're going to take the ball behind our right knee, so our legs are in parallel. The ball's tucked behind the right knee. You can use a water bottle for this, or a small hand weight, or even a cushion if you don't have a ball. Hands under your shoulders, lift, look straight down, find your pelvis neutral. I'm going to start with my baby hug and pelvic floor, and then breathe out, that right leg comes up. I'm just going to glance down and make sure I've not swung my hips out to the left. I'm going to keep my left thigh completely vertical. I lift that leg only as high as I can without dipping into my back, feeling that resistance work through my tummy. Okay, one more, holding it at the top here, hold it here. Squeeze that ball behind the knee. Keep that baby hug, gentle pelvic floor contraction, neck is long. Keep breathing for last 10. 3, 2, and squeeze, hold. Knee comes out to the side and in and down. Foot stays still and you're just coming into that clown position. When I look down, my pelvis is pointing straight down and I'm just pivoting from my hip socket. Strong through that upper body. This is great postural work. Good for your shoulders. It's a really stable position for your shoulders. All of your muscles around there are getting stronger. Holding the weight in a good stable position. 4 more. 3, 2, 1. And come in, come down. Now adding in that left arm reach. So chest lift, taking up the load on that right arm. Left arm comes away as my right leg lifts up and down, just for 10. Feeling that tension build through the tummy, keeping that ball squeezed so you really get that hamstring working. Try and maintain that baby hug all the way through. Last one. And relax down, really brilliant. Take the ball away and just stretch through one arm. Twist open to the sky and then thread the arm underneath the opposite arm. Slide the hand along the floor and just start to bend that left elbow. Just trying to rotate as far as you can without swinging your hips from side to side. You might just go a little way, you might get all the way down to the mat. See how you feel, just feel that stretch through your body. Press away, open, twist back under. Just where you feel that stretch between your shoulder blades. Change sides. Opposite arm open, get that space under your ribs. Rotate, hand across the floor, bending your opposite elbow, look through. And come up. And rotate. Let's do one more. And hand to floor. Okay, now we're going to come into a little side lying set next. So taking position on your side, being careful when you change over you, keeping your legs together. Take up a cushion underneath your head or a pillow. And we're going to bring our arm in front of that cushion so your neck is relaxed, okay? So it just keeps your neck long, so you want to have enough pillow so your neck's not down towards the floor. Bring your legs right up in front of you. So we're going to work on our big glute max muscle in our bottom. So for that, we need our legs up at 90 degrees at our hips, 90 degrees at our knees. We're going to still from there lift through our waist and find our pelvis neutral, so we're not sticking our bottoms out, we're not tucking all the way in, we're still in neutral, neck is long. First thing I'm going to do is baby hug. That gentle activation in the low part of our tummy and pelvic floor. And then we're going to pivot our whole knee and foot open to the sky. And then back down. So you're just squeezing your heels together and opening that top leg up and down. So this is a modified clams. Try and get your big glute max working. Powerhouse in our bottom. Really good for giving us force closure through our pelvis, helping to prevent any pelvic girdle pain creeping in. Okay, now as we get a bit more dynamic, this is enough for you. You are showing signs of pelvic girdle pain. Keep your heels pressing together. Otherwise, we're going to add in a kick. We're going to open, kick, bend, close, open, kick, bend, close. Keep that going, really working through the back of the leg into your bottom. Your tummy is on because you're balanced on your bottom hip here. Your waist is lifted. Make sure you're not giving into the mat too much. And just give me 4 more. 3, 2, and 1. Good work. Now slide those legs straight for me. This is a great all-round work. So it's going to get your tummy coming on, your pelvic stabilizers, your inner thigh, your outer thigh, everything's working. Use your hand if you need to, otherwise bring your hand onto your top hip. That top leg is going to float just 1 inch off the bottom leg. Get that baby hug on and bring the bottom leg up to join it. Squeeze your legs together and come back down. Just check in with any pain through the front of the pubis here. Shouldn't be anything going on there because you're keeping your pelvis in line. You're just moving those legs just a small way, creating that strength in the outer thigh Inner thigh, waist lifted, tummy is strong. Good. Lift and lower. Lift, lift, squeeze and lower. Shoulder stays down, baby hug stays on. Four more. Last one. And calm down. Good. Just pop a little bend in your knees so you can relax. Whilst we're here, the best exercise to get that chest open, to create that good upright posture in the upper part of the body, is arm opening. What I'm going to get you to do is just reach that arm forward, shoulder blade comes around, arm to the sky, and then bend your elbow back behind you. Just feel where you can take that arm into that natural stretch. Hold that twist without your pelvis falling backwards. Your pelvis bones stay stacked. Breathe in. Breathe out. Reach, 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 reach. Close. Feel how that arm feels a bit longer than the other. Stretch again. Create a straight line. As soon as your hand's in line with your eye, rotate your breastbone back. Bend that elbow back to feel that stretch without flinging your arm behind you. Keep the pelvis stacked. Ribs in. Breathe in. Breathe out. One last one. Reach. Take it to wherever you feel your stretch. It might be sooner than me. It might be further back than me. A little bit blocked by my wall, so you might come back a little bit further. Stay looking at your hand the whole time. Breathe in. Breathe out. Really good. Now we're going to change ends of our mats. Get used to changing position by holding our legs together. Okay, so we're going to bring those legs in front. Cushion comes over, and then we swing our legs around. Make sure you're long on your mat. Don't bunch yourself up. Use the whole length of your body so you don't stay where you put yourself. Stretch yourself out, then fold those legs up in front of you. 90 degrees at your hips, 90 degrees at your knees. Your neck is relaxed, your shoulders are down, ribs are soft, pelvis is neutral. Baby hug. Open up that top leg and then release. Pivot from the hip and the heel and then close. Two more. And one. Now either stay here with that first level or come into an open kick. So you clam, kick, close, lower. Clam, kick, close, lower. And the kick is kind of up towards where the wall meets the ceiling. So it's on like that natural joint. So the leg is going up, not just a forwards kick. Try and keep that baby hug the whole way through. Just 3 to go. 2. And 1. And relaxing that down. Now straighten your legs out all the way down here. And with that, reach, reach, reach through your body. Your bottom waist comes up. Work through there so you get all of your trunk working, your back and your tummy muscles. Top hand for balance if you need to, baby hug. Top leg lifts, bottom leg floats, squeeze together, control that down. Top leg lifts, bottom leg floats, squeeze together, release that down. Good, so you just got that strength all the way around your pelvis, like a ring of muscles going all the way around your body, holding you together, creating that forced closure. 4 to go. Last one. And relax down. Take your legs into a comfortable position for you and bring your arms in front of you. Keeping your hips stacked, don't let them roll backwards. Reach your top arm forwards, get some space under your shoulder, in your neck. And then open that arm up, look at it with your hand. When you get in line with your head, twist backwards, and that twist, you're bending your elbow, and that's where you get the openness through your chest. Breathe in, breathe out, reach, 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 reach. And again, reach forwards, come up, hand in line with your eye, rotate back, bending your elbow. Breathe in, breathe out. Let's do one more, reach, open, and rotate back. Really good. Okay, we're going to push up into mermaid sitting. So legs stay together, use your hands to help you. So you can either keep your legs on top of one another like this, or if your pelvis is okay to open, you're going to open up your legs so one foot is on the thigh. So let's come to mermaid stretch. So the foot that's out behind you, that hand comes just down by your foot, and you reach up and over that side. Lengthen stretch, so nice. As your muscles start to tug on your ribs, baby starts to move up and take up even more space inside your tummy. Breathe into your ribs and enjoy that lovely stretch under there. Rotate down towards the ground. Rotate to the sky. And over. We're going to change sides. So either those legs come together and then you just sit just off of one another here so your pelvis isn't too open. If it's okay to open your pelvis, we're going to bring one foot on your thigh like this. And the foot that's out behind you, that hand comes down. Reach up and over. Stretch through your body. Breathe into that stretch. Rotate down to the floor. Rotate to the sky. Into the middle. And relax. And well done everybody. That's our programme for month 6. So I look forward to seeing you back here in month 7 to our 3rd trimester. Thanks for joining me.